Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you today. Proper sleep hygiene to have good postprandial blood sugar control. Diabetic patients often report higher rates of insomnia, poor sleep quality, excessive daytime sleepiness, and higher use of sleeping medications. Sleep quality also has a direct causal effect on many conditions such as cardiovascular disease, obesity, and even type 2 diabetes. Several studies suggest a strong link between sleep quality or duration with glucose homeostasis. A recent study in the Diabetologia journal reveals poor sleep efficiency and later bedtime routines are associated with more pronounced postprandial glycemic responses to breakfast the following morning. A person's deviation from their usual sleep pattern was also associated with postprandial glycemic control. Early dialysis initiation in chronic kidney disease may reduce cardiovascular events and even mortality. Worldwide, more than 3 million people with kidney failure need maintenance dialysis treatment for survival. A group of researchers conducted a study to identify the optimal estimated glomerular filtration rate at which to initiate the dialysis in such people with advanced chronic kidney disease, and the study revealed that about 5.1% absolute risk difference corresponded to a mean postponement of death of 1.5 months over 5 years of follow-up. The early initiation of dialysis was associated with a modest reduction in mortality and cardiovascular events. For such patients, a reduction may not outweigh the burden of a substantially longer period spent on dialysis. Yoga sign, a dermatological manifestation of yoga posture. The yoga sign refers to pigmented callosities on the skin over the lateral malleoli and at times even over the fifth metatarsal and phalangeal bones. Repeated shearing forces, friction, and pressure leads to hyperkeratosis, which further increases pressure, creating a vicious cycle of friction, pressure, and thickening of the skin. Unlike in corns, these are distributed over a much broader area. The authors saw a marked reduction in the degree of hyperkeratosis and hyperpigmentation by relieving the pressure and friction using thick, soft padding under the callosities. The authors also advise for long-term application of 6% salicylic acid ointment and 10% urea cream daily. Tigolixosat lowers the uric acid levels in gout patients with hyperuricemia. Gout is a form of arthritis which can be effectively managed by inhibiting the uric acid synthesis. Tigolixosat, a novel non-purine selective xanthine oxidase inhibitor, lowers the uric acid production and is shown to be well tolerated up to a maximum dose of 800 mg per day for 7-day administration in healthy subjects. This was revealed in a first-in-human clinical study. This study in the US showed that Tigolixosat significantly lowers the levels of serum uric acid in gout patients with hyperuricemia versus placebo at all dose levels, according to the results from that phase 2 dose-finding study. Also, the serum uric acid lowering effect of Tigolixosat appeared to be a dose-dependent. Study participants tolerated well to the treatment with Tigolixosat at all 3 dose levels. Financial incentives help pregnant women to quit smoking. Quitting smoking is crucial to mostly healthier mothers and babies, yet evidence suggests that less than half of women who are daily smokers successfully quit during pregnancy. Previous studies of financial incentives have shown promising results but have not been put into practice as yet. A trial from France published in the BMJ journal has highlighted that pregnant women are more likely to stop smoking if financial incentives are offered as a part of their treatment plan. The results show that rewarding women for their smoking abstinence with vouchers throughout their pregnancy was associated with an increase in continuous abstinence rate compared with no vouchers. Hence, the long-term effectiveness of financial incentives on smoking abstinence after delivery should strongly be assessed. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.